Hi, my name's David Aaron and I'm the Consultant Clinical Psychologist for the Regional Burns Centre at Pinderfields Hospital in Wakefield. I work predominantly with adult patients and their families. My colleague Catherine Wright, another psychologist, works with children and their families in the Burns Centre, and she's produced a video herself to address the issues with paediatric burns patients. So there's been a number of changes, of course, to the way that hospitals are providing their support to patients, with fewer patients coming onto the hospital site, and of course that's the same for the Regional Burns Centre. Whereas patients would have come and seen the whole team, from nurses to physiotherapists, at times, more commonly seeing occupational therapists, and occasionally seeing a psychologist. This has been subject to quite a lot of change. We're having to see people over video or over the phone, and relying upon telemedicine, which is an online service that enables photos to be uploaded and to be considered by the team and for advice to be given. So there's a lot more discrete bits of input being given, rather than this whole general team approach where relationships would have been built, and conversations about emotional difficulties may well have arisen from just an informal chat with someone. So that's the reason that I'm put this video together, to raise awareness of some of the emotional aspects that might not be routinely top of the list when you're having to engage with our service in very kind of unusual ways. If at any point you felt as if you were struggling psychologically as a result of your burn injury, then I would invite you to phone the Regional Burns Centre and ask for a referral to be made to myself, David Aaron, and to Catherine Wright if it's regarding a child's burn. And what will happen is that I will then make a call to you to discuss some of your concerns and whether I can be of any, our service can be of any support to you, or in fact whether other services might be more relevant if your needs aren't necessarily directly related to a burn injury and are more of another nature, like mental health, ongoing mental health concerns or social concerns. Things to look out for: there is another video on this Regional Burns, Pinderfields Regional Burns YouTube channel, which you can look for in more full, but in brief for the purpose of this video. Issues around post-traumatic stress symptoms, so psychological reactions to traumatic incidents, of which burns are commonly seen as traumatic incidents. Things like flashbacks, difficult nightmares, dreams, a state of hyper-anxiety and alertness to danger, as well as difficulties with mood, anger, anxiety in general. Other issues include preoccupation and anxiety around self-image and appearance relating to burn injuries. And then anxieties around the future, and particularly losses of roles that have come as a result of your injury. A couple of things to mention: that these difficulties, and there are more, are not inevitable for everybody, but nor, if you experiencing them, are they a pathological reaction, an abnormal reaction to a burn injury. They're all expected, and therefore you shouldn't worry too much about whether this means that you have lots of other problems on top of that. These psychological reactions are expected most of the time. The other thing to mention is that obviously we're in unprecedented times at the moment, and there are lots of understandable and normal reactions to the coronavirus too, including many of the similar symptoms that I outlined in relation to burn injury. So I think it's important more than ever to have the ability to think through the psychological difficulties and how much of those relate to a burn injury and how much of them relate to kind of a normal reaction to the general state of things at the moment. If in doubt, I would always invite you to speak to a member of staff and to request a phone conversation with myself, and I can arrange that with you. Thanks.